a microphone I can walk around the room with, and maybe that's better. Any heads up on that one? Does that help? Okay, that's better. Thanks for your input. Good. Okay, here we go. So just going to push the start button here to record this. Just a moment. So hi, this is Dr. Alexander Haskell, naturopathic physician, presenting a webinar on the optimizing of thyroid hormones. And the reason why I've put this webinar together was primarily because of those first 3 videos. If you had a chance to watch them, you understand from the research from around the world how low thyroid hormones, hormone disease, Hashimoto's, iodine, all those components that are around the thyroid gland, they are, if they're not optimized, are obvious risk factors for women developing breast disease, and which can then go on to breast cancer. Seldom, and I don't know if it would ever happen, would a woman develop breast cancer without having gone through certain pre-stages of abnormal tissues and fibrocystic disease and various things like that. So the impetus for this webinar was to address one of the major risk factors for developing breast disease. But I think you'll find that there are many, many other problems or symptoms that develop in both men and women who start to have low thyroid hormones. We're going to go through a number of slides today, which I think you'd be very impressed about how simple thyroid hormone biochemistry or physiology is, and how easy it would be for anyone with the knowledge I'm going to share with you, for them to take a more proactive role in their health. So let's move on here, hopefully. Just one second. There we are. Okay, so my feeling is that what we're offering is knowledge that I spent a couple of years doing a lot of research for a couple of books, and found tremendous amounts of research back in the 1950s all the way up until recently, this month, and I was so overwhelmed with how much information there was, and what we're doing now is trying to share this with you so you can take more control of your health. But now, who has the power now? And I can tell you lots of stories about patients whom I discuss things with, who approach their physician to have certain blood tests done. And it depends. Some physicians are very open-minded and are willing to work with their patient, and others are strictly in a position of power. And actually, I know of a couple of patients who were basically refused by their physician to be seen anymore because either they asked too many questions or they were asking for things the doctor did not want to do. One woman went to her endocrinologist asking to have her TPO antibodies checked to see if she had Hashimoto's. The physician's reaction was, "What kind of quack are you going to now? Something online that you found?" Anyway, she found a lab in her city, had the test done, she was positive for Hashimoto's. So I know sometimes we can be intimidated going into a physician's office, but I think the more knowledgeable we are, the more relaxed and the more respectful we can be towards our physician to receive the help we need. So what I can teach you that can help change your life is the point of advancing breast care, advancing medical care, which we're involved with. The biochemistry of thyroid hormones, you'll be very surprised how simple it really is. You'll learn about the 4 thyroid hormone tests and how to interpret these hormone tests. And maybe, unless your physician just came out of school, I have a feeling that you will know more after this webinar than your physician. I know it's hard to believe, but maybe I'll ask that question at the end of what I present today. So you'll know what hypothyroidism is. You'll also know what subclinical hypothyroidism and also kind of a new term. It may not be that new, but it's something that I think is important to understand what suboptimal hypothyroidism is as well. I don't consider any of these to be a disease. I consider them to be a condition that's not being treated properly. You'll understand the two primary causes of hypothyroidism and the different types of thyroid hormone medication that is available by prescription. Also know about the nutrients, how to use iodine and iodide in a very safe manner. This is a big subject now because of Dr. Brownstein and Dr. Abrams having promoted through a lot of healthcare practitioners, myself being one of them for a while, the use of high doses of iodine. And I found some pretty startling things that happened to people's blood chemistry related to this approach of high iodine and iodide. And I'll discuss more of that a little bit later. Learn about thyroid hormones and both the two female hormones and the interaction between them. How to improve the relationship with your physician. I'll talk about that at the very end. I want to clarify that medical technology is just phenomenal. I mean, what we can do now as far as testing compared to the early 1960s, we didn't even have any thyroid lab tests up until the early 60s. Doctors at that point could only they would select usually Armour or a desiccated thyroid hormone prescription for their client who they suspected had hypothyroidism. The only other lab tests that we had that would help to confirm that was cholesterol. And usually with hypothyroidism, you'll find elevated cholesterol, and also especially the LDL form of cholesterol is going to go up with low thyroid hormone problems. To improve thyroid hormones, a physician needs to be a part of your team. You cannot do this. You cannot guess whether or not you have a thyroid problem. You can have cold extremities, you can have hair loss, you can have weight gain, all the typical symptoms of hypothyroidism, but it can be for other reasons as well, especially a chronic illness, a chronic viral problem, low adrenal function with low cortisol levels, blood sugar imbalances. You need to be working with someone who's a physician who's willing to take a look at your chemistry to really differentiate or to see what extent thyroids are part of your problem or symptoms. So let's get started. Let me see how many people are here now. Okay, good. Everybody okay with the sound and everything? Okay, good. So we're going to talk about the four primary thyroid hormones. TSH, or thyroid stimulating hormone, is made by a gland in the brain called the pituitary. This hormone TSH stimulates the thyroid cells to increase their production of thyroid hormones. It's very basic, thyroid stimulating hormone. Okay, so when thyroid hormones, TH stands for thyroid hormones, start going down, what is supposed to happen is, and there should be a little thing next to the arrow going up. It should say TSH goes up. So when thyroid hormones go down, TSH should go up. Let me get out my little pointer here just one second. Here we are. As long as you use the pen. Oh, this is going to be hard with one hand holding the microphone. So this should be going up. That's fairly normal. And sometimes, even when thyroid hormones go down, sometimes for some people TSH does not go up. So we're talking about what's normally supposed to happen is that the TSH should go up when thyroid hormones start going down. Okay, I'm kind of new at this. Just one second. Get rid of the pen. Okay. So iodine, do me a favor, honey. Can you use this pen and make some drawings I can't do with a single hand? So normally iodide, when the thyroid absorbs what it needs to make thyroid hormones, it absorbs a trace mineral iodide. It does not absorb iodine. So there are receptors on thyroid cells known as iodine trap, also known as sodium iodide symports. It's just a channel that helps to absorb more iodide. So those little symports, you can see that little black, little side U-shaped thing. That's to represent a little symport. TSH, just draw a line from there point to it. TSH stimulates that symport, that iodine trap, to absorb more iodide inside of thyroid cells. So thus far there's two functions of TSH. One is basically to stimulate the thyroid to make more hormones, and one way it does that is that it increases the activity of those symports to absorb more iodide. Another thing that TSH does is that inside the thyroid cells, before the thyroid hormones can be made, iodide must be changed into iodine. And the way that it does that is that the thyroid cell produces hydrogen peroxide. TSH stimulates the production of hydrogen peroxide inside the cell. Okay, very straightforward, very easy to understand. There's also on the breast the same type of symports that allow iodine to be absorbed into breast tissue. This is very, very important for not only the protection of the breast from environmental or endocrine disrupting chemicals, but also it's a way that the woman during the last trimester of her pregnancy is absorbing a lot more iodine into the breast for lactation. Iodine is extremely important for the development of the infant and especially the brain. You may have heard of cretinism, which is a poor development of the physical and the mental in children that are either totally deficient in iodine or for some genetic reason they cannot absorb iodine into their bodies. Let's move on to the second hormone, known as T4 or thyroxine. This is the primary thyroid hormone. It's also known as the prohormone or the mother hormone because from T4, other thyroid hormones are made. In measuring thyroid hormones in blood tests, it's very important to know about the T4 because that really helps us understand how well the thyroid is able to produce or manufacture its hormones. So we have, just to the side here, T4 can go on to be making T3. I'll get to that in just a moment. And can also go on to making what's called reverse T3, which is a whole nother subject, which I'm not going to get into today. So T3, I'm going to back up for a second. You see on the T4,